So when I'm speaking with CLM implementers or organizations that want to start up CLM, I always say choose the indicators that will tell you what you want to know. Hone in on focusing what those things are, because the indicators that you select and the number of them will be dependent on that. And from those indicators will generate a volume of data. And that volume of data then will need to be analyzed and reviewed. And so the more indicators you have, the more volume of data you generate. And then it could become overwhelming. So I would say probably starting with no more than 10. The number of indicators is important, but what's also really important is disaggregation. Each disaggregation is going to be a stream of data. So it's not just the number of indicators, it's also looking at your types of disaggregation, because that's also adding the volume. But I would say probably around 10 is maybe sufficient if you have the right types of disaggregation to tell you what you want to know and the story behind, the numbers. Changing indicators, there's a lot of reasons for changing indicators. The indicator changing or reducing can be based on, it's not really telling you information that's going to be useful for you. There's also reasons related to populations change. Their needs change, and so those indicators may need to change based on, their situation changing. There's also capacity issues, why indicators may need to be reduced. So if there's too much data that it's not actually then allowing the organization itself to analyze and then use the data for advocacy, then there needs to be a real thoughtful, hey, we got to do something about it for us to actually be able to use the data. Because of course the purpose of CLM is to use the data. So, and then also just changing indicators, adding new ones, it's always so easy to add indicators. Sometimes it's not even about adding indicators, it's adding a different disaggregation, because you realize maybe a subpopulation is facing an issue that you didn't realize, but through your piloting, you realize, we really need to address the issues of adolescent girls and young women, for instance, where maybe they weren't part of the data collection before. Also, sometimes donors, sometimes they'll look at an indicator framework and say, hey, we're really struggling trying to understand why in our supported sites, these issues, we're not really reaching targets, or we know there's a problem, but we don't know why. Would you be willing to add an indicator to monitor that? And that's a nice partnership, so I don't always think that it necessarily needs to be 100% community-led in that sense, because in many ways, it's also helping a donor who is supporting service delivery actually improve their services as well. So there can be sometimes that back and forth and that negotiation and compromise, where indicators can also be added based on a donor saying, hey, I really need you to help us unpack this issue, and this program that you're doing may actually be the answer. Yeah, so in terms of having lots and lots of indicators, if it's just on one singular disease issue, maybe 10 would be okay. But once you start adding like co-infection or comorbidities or COVID or quality of care, just general indicators, it just adds more and more and more and more. And so sometimes you look at a program, why is there 40 indicators? But it may be because they're doing a lot of issues, but then that means that must be a massive, massive, massive program, and they would most likely require a lot of funding for that, because the number of data collectors you would need to collect that range of data for that many indicators is going to be really, really high. There's a correlation between your indicator, then the amount of time that it's going to take to then clean and code and analyze, and then disaggregate, and then prioritize issues for advocacy. Every single indicator probably costs a certain amount of money. And so when you think about your budget, it's not just about how much, your time is based on how many indicators, how many forms you're going to need to review, how many focus group discussions you're going to need to plan and recruit participants for, how many sites you're going to need to go, or data collectors you're going to need to supervise. So every indicator, is adding this cost element to your program, just for the mere fact that it creates data that needs to be analyzed in the time that it takes to do it. So there's two sort of major cost elements there. right? Sites and indicators. Sites is the volume of data and the time, and the sites, how many places do you need to go to get the data for those indicators. So this is also something that I think the funders really need to really understand, because sometimes they think, oh, you're just going to collect from a certain number of sites, great, we're going to get some data, and oh, on these indicators. But all of the different pieces that need to create a functioning and effective program, it has to be set up, and there needs to be a lot of thought and time put into budgeting for that, because the budget will ensure yes or no that it's actually going to be effective or not, and going to lead to any changes. If you add a site, it may cost this much because it's going to require data collectors for every site. You can't just expect the same number of data collectors to be adding on more sites. That was not part of their job description in the beginning. They were only assigned 5 sites, now you're adding 2 more to them. That adds cost and time. So that needs to be built into the budget. And a lot of times they say, here's your envelope. This is another way. They say, here's your budget envelope. I'm facing this right now. They say, okay, this grant has $200,000 in it. But we want to do this program across 3 countries. And 8 sites. Well, okay, so what can you do with this amount of money? And it's a reverse process, where instead of you have the openness to be able to design your budget, now it's the opposite question. What can you do with this amount of money? And that's a tricky one as well, because you want to be able to do a lot because you're happy with the opportunity, but then you realize, oh, that's not really going to get us a lot, and maybe we're only going to be able to do like 3 places out of the 8. So there's 2 ways sometimes it can happen. In my view, it relates to this disconnect sometimes between the identification of problems and issues and then the mismatch of indicators, where they have a lot of indicators around the issue, but you really only needed the 1 or 2 that will address the actual issue. And so they pile on all of these different indicators when you really only needed those 2. So that's a common mistake. And so that process, that consultation process with the organization implementing the CLM and whoever is supporting, them through that discussion process to kind of refine their indicator framework, always need to ask that question. Okay, is this indicator, your problem is here, your issue is here, is this indicator, if you think ahead, will the data that you're going to get from that indicator really tell you exactly what may be the problem with this issue? And then the other thing that I see sometimes, common mistakes with indicators, is this inability to basically be okay with eliminating an indicator. It's a weird thing where it's easy to add, but it's really hard for humans, I think, in our psychology and our conditioning and our societal development. I don't know. But to take away is seen as, not okay, not as good. Oh, we are not doing a great job. But we need to be comfortable in CLM to say, this indicator, okay, we don't need this indicator, and walk away and be totally fine. So there's many reasons why you need to pilot indicators. Number 1, you want to be able to see, are these indicators getting the information that you really need to know? 2 is the data collectors need to be comfortable with the indicators. Are the indicators clear? Do they make sense? Are they interpreted well by the person you're asking for the information around those indicators or not? It's a lot about making sure that you can correct, reduce, add indicators according to what the learning is in the first pilot. And that's a huge opportunity to also understand, is your process for data collection also working, and how we can improve? Because a lot of it is around data collection for the indicators. And if your process is flawed in some way, if the timing isn't right, if the data collectors are tasked with too much, then that needs to be worked in the next phase of data collection so that it functions better.